Hello, everyone. This is Mark Anthony with AIEdgePodcast.com, the place where we bring you the best of the best doctors in their niche. Today, I have a special guest, and also I would call as a friend, Dr. Andrew Harris. Let me give you guys a little bit of information on Dr. Harris. He attended Wilkes University and Life Chiropractic College. Guess what? Where he received his Bachelor of Science and Electrical Engineer. You can also find him at flspinedisc.com, flspinedisc.com. Today, we're going to talk about why the spine can make you or break you and why it's important. A lot of people ignore the spine. They ignore the posture. I know for myself, I've got to always keep my back straight, and I just want to go forward. But with that being said, thank you so much, Doctor, for being here on the show.
Hey, thank you, Mark. It's great to be here, and I actually enjoyed our time together down in Tupelo a couple weeks ago.
Food.
Yeah,
That was some tacos, man.
Those were absolutely top notch. Very, very good stuff.
Yeah, exactly. So, well, before we get into the great of things, tell us, how did you get into chiropractic and most likely just focusing on the spine and helping people?
As you said, I attended a small school in Pennsylvania called Wilkes College. Went through there, had an engineering degree. Honestly, math science were my forte, but it just was overwhelming. And halfway through my junior year, I didn't even know if I wanted to stay that course. So my father, he's convinced me to stay, get out, get a job. And then engineering, there's many facets of engineering. So I got out, and as I worked for a nuclear power facility down in Georgia, I was also equally playing rugby. I played rugby for probably 19 seasons, about 10 years. And at that time from Augusta, I'd also stumbled across medical college in Georgia. So I'd gone down there and been accepted to MCG. So I was going to start. And in that process, in that year window of time between then, while I was still working, I injured my back pretty bad. I mean, I severely injured in a rugby game. And through a long process, I found chiropractic. And when I found it, I realized that, hey, this is something I think I'm more congruent with. The no drugs, no medication, let the body heal thyself. I was really in that mindset at 23 years of age, and so I put the medical college on hold and really wanted to understand chiropractic and the healing powers of that. And then fast forward, it had some family issues. We all do, right? My mom had gotten ill, moved back to Pennsylvania, but at the age of 28, whatever I did not have sold, I threw away, and whatever didn't fit in my car, just packed it all up and moved to Georgia and started chiropractic school at 28. Started all over.
Wow. And how long have you currently been in business right now? And tell us a little about your practice, where your practice is at, and where we can find you.
I graduated in March of '99, and so immediately after that, I went back to Pennsylvania. Was up there for 15 years. Had a really nice family-based practice, and I mean family. We had multi-generations. 78 or 80% of the practice were 2 or 4 members of the same family. So
Wow.
dads and daughters. It was a really, when I say it's family oriented, it was family oriented. It was Harris Family Chiropractic. It embodied the name, and it was a really wonderful healing. Really loved it. We probably had about 120 children born into the practice over that time frame. So a lot of moms that were pregnant, and then we moved, my ex-wife and I and our family moved to Florida about 10 years ago. And so we came to Ormond Beach. It's a beautiful little beach town nestled right above Daytona. And at that time frame, started the same type of practice, that same family-based dynamic. But where we are in Florida, it's kind of transient. A lot of transient people, a lot of snowbirds, a lot of older people. And in that time frame, the business model just wasn't quite the same. And as you kind of have to evolve sometimes. And so as I was going through this, I started getting more and more and more disc and more breakdown and more men and women that just had really horrific, bad backs. My practice in Pennsylvania was more wellness based. Down here, I was really dealing with some really ugly backs. I mean, the worst that I'd ever seen. So in that manner, after about 2 or 3 years, I kind of changed my focus, and I really started understanding the integrity of the disc, the patency of the disc. And I started to change. I really changed my whole office structure completely from that family wellness practice to now where we're really spine and disc related.
Well, that's awesome. So why do you think the spine is the number one thing that people should be focusing on, or should it just be chiropractic, or are they both the same?
Well, I think when you get right down to it, I think it's health, right? So if we look at health and wellness, so when you look at it, and I think health and wellness for many people are different things. Some people, health and wellness is going to the gym, right? Hey, I want to go to the gym every day and I'm going to work out. Some people, it's, hey, I want to read scripture every day, being in verse, right? Some people it's diet. Some people it's nutrition. Like, I think each person has their own dynamic of what they think maybe healthy and wellness is. You're talking about a spine, I'm talking about the spine. If it's not maintained, it's not part of a healthy lifestyle. It's not a question if, it's a question when the spine will start to break down. Depends on your activity level, traumas, falls, slips, just the dynamic of everything over a lifetime. So if it's not managed properly, there will come a point in time where your back and your back health will start to let you know there is a problem. And most people, that starts to happen in their, these 50s. So again, from a healthy lifestyle, yeah, I think maintaining your spine is just like maintaining your teeth. You brush and floss every day. You go to a dentist once a year to just make certain you don't have an issue. You're being proactive. Again, I think the same thing should hold true to your spinal health and spinal hygiene.
Wow. What would you say? Like what are some of the systems that you use for spine for people that come in your office that you recommend and that are helping people?
I'd say from a system dynamic one, usually by the time somebody sees me, they're in pain. Let's be honest. We either have acute pain, I just bent down and I can't get back up, right? I've got that acute aspect, or I've got this pain that's been on again, off again, that's been killing me for 3 or 4 years and nobody can help it. So our first system for anybody is when we're taking x-rays because we want to identify the integrity, we want to identify degeneration, breakdown, any of all those factors that could play into it. I tell men and women this: if you have a pain that lasts more than 3 or 4 days, we know that's not a muscle-based issue, it's a nerve-based issue.
Oh, wow.
Right. So it's always kind of like an easy rule, rule of thumb. So if it's a nerve-based issue, now it's two things. It's either going to be one, if the alignment of the spine's off, that's pinching the nerve, or two, we have a disc that's breaking down and that's going to be damaging the nerve. So the x-ray is an easy way for us to identify, is it an alignment, is it a disc, or is it a combination of both? So at that point, regardless of the acute situation or if it's chronic, we already have a really strong foundation as far as where we go. And depending if it's a disc breakdown, which so many people do it later in years, we have specialized equipment in the office that can help restore the disc, help heal the disc, let the disc inflammation around the disc and the nerve actually settle itself down and get people out of pain naturally, effectively, without the use, again, drug surgeries. That's our goal.
Well, so would you say the spine is something that can be fixed and regenerated where it can actually heal itself, or is that something different?
I think the body itself is an aspect where it can regenerate itself. I think the body, we're self-healing, right? So and no matter what the dynamic is, you may have high blood pressure, but if you have high blood pressure, well, let's modify dietary habits. Let's increase exercise. Let's not take medication every day of your life. Same way with type 2 diabetics or cholesterol, like those big three that we deal with all the time. I call them the trifecta. Anything happens with the spine, as long as the degeneration is not so severe, as long as you don't have fusion, like there are some things that you can't change. But, as long as there's still disc remaining, as long as there's things in there that we can still viably work on, then yeah, there's a lot that can be done. Can't bring it back to normal, but we can certainly get you to an increased state of health, reduce pain levels. Those are the goals that we want to do. So it really, I guess to answer your question, really depends on the amount of damage that's there and how long the damage has been there.
What are the top type of 3 spines that you normally see a lot coming into your office of, maybe whether it be someone with neuropathy, maybe overweight? What would you say the top 3 that maybe come to your mind?
Well, averages right now, 73% of all Americans are overweight. Okay. So that's the average. And with that, 43% of those 73% are considered to be obese. That's a huge number. We talk about just the health and wellness of America, and that's America, not worldwide. So, but what are the top things we see? We see all the time. We see disc breakdown. Normally, when I see disc breakdown in the low back, it's the lowest back. It's either L4, L5 or L5S1. And Mark, there's 5 bones in your lower spine, and they're numbered 1, 2, 3, 4, 5. And then the base, you have your sacrum. So the disc that's between L5 and S1, we call that the L5S1 disc. The disc between L4, L5, that's the L4-5 disc, and so forth and so on. So in the low back, those are the 2 that we see primarily. And then the neck, in this area, we have 7 vertebrae, and the ones that are culprits there are 4, 5, 5, 6, and 6, 7. Those are out of all the discs in the body, those are the 5 that we see the most breakdown, the most degeneration in that region. And then so that's it. So pain, that's directly related to that. Secondly, we see certainly sciatica, which is because that nerve's been damaged so long, it's affecting that pathway down the leg. And then lastly, without a doubt, it's radiculopathy in the hands. You start to lose sensation, feeling, motor function. So we see that dynamic pretty much every day of the week and twice on Sunday.
Wow. So what I'm hearing you say is that when somebody goes into your office, you basically do an entire full body scan to see what's really the problem. And it may necessarily not even be the disc. It could be something that's maybe connected to the disc.
Yeah. So in a case like that, so if we have patients that come in, they can have low back pain, and they could very easily have, neuropathy in their legs. We're able to identify if that neuropathy is from the spine or the nerve, or if it's more of a metabolic based issue. If it's a metabolic based issue, then it's different treatment protocols for that. We can work on the disc morning, noon, and night, but that's not going to be the causative factor. It's going to be other things that are happening internally. And we are able to identify that, and over a period of time, help those nerves heal, which that happens a lot with people that like type 2 diabetics. These
Right.
men and women have poor circulation. And because of that, over time, and it's years, decades, that they now start to lose their feeling in their hands and their feet. And that becomes really problematic as they just try to lead a normal life.
Well, so I know you work primarily with spine, but what are some other things that you're also helping people with that are in your clinic that you're also seeing other niches, as I would say, like neuropathy, other like what are some other things?
The one thing that we've done is we've brought into the office. So the same dynamic with the disc. When a disc breaks down, the disc breaks down and it gets smaller. So our
Mhm.
office is to open that space up, hence get the body healthy in that sense. Pardon me. We do the same thing for a knee. When you have the femur and the tibia, they come together, and there's this pad that's in between there. It's called a meniscus. And over years, and we're talking again decades, that meniscus can break down and get smaller and smaller. Which now we're dealing with a large majority of men and women at young ages, in 40s and 50s, that are faced with knee replacements. We have a special type of machinery in the office that can actually separate that space and then also help regenerate that meniscus in there as well. So really some high tech, really, top notch work that we do to get people, again, give them relief, get them functional, lead a life without pain, but most importantly, keep them away from going under the knife from a total knee replacement. Because if they do that at 45 or 50, then they're going to have to do it again in about 15 to 20 years. So they've got at least two knee replacements ahead of them, and sometimes it's bilateral. So now they've got to have it both done, which nobody wants to do that. So yeah, we do a lot of knee based work, and that's been a nice thing that we started to do. We brought that back. We brought that in 2024. I'm just amazed at the results that we have with our patients. It's been remarkable. But again, seeing them just being able to be good grandparents and enjoy their grandchildren or go out for a walk. We live in Florida, so we have a really, this time of year is beautiful. So being able to bike ride, whatever it's going to be. So it's just nice to see them regain control of their life.
Would you say that the knee and from your studies being around it a lot, the knee and the back, the spine is a lot alike as in to work with?
Yeah, I mean, I always say the knee is kind of a conduit. It's a conduit between the hip and then certainly to the ankle. And what I've seen, I'm an avid runner. I've spent the last 30 years running. And so I treated a lot of runners, and I did a lot initially years ago. I did a lot of casting of my own orthotics because 80% of the population pronates. And what I
Mhm.
mean by that is they have flat feet. Flat foot, and that arch in the foot is not there. Over time, it's going to start to wear on the knee. Makes sense, right? They're all connected together. So if the average person, let's say, does 5,000 steps a day or 6,000 steps a day, that's 3 miles a day. Well, 3 miles a day over 7 days a week,
Right.
over 52 weeks a year. Like, we start to take that dynamic of it, we're talking, hundreds of thousands of miles on the knee in a bad integrity. And that's why the knee will break down. So, I see that as a major issue. If we can help men and women keep that pronation and help stabilize that ankle, that has a huge impact on the knee. But then it also is a byproduct to the hip as well, and then the low back. So they all work together, this lower kinetic chain, and
Uh-huh.
they can also then all start to break down. And normally when one breaks down, it's a domino effect. They all seem to start to go.
So what are some things that maybe you recommend that maybe can help people before they see, or things that they can start doing that would maybe help them just to be a little bit more comfortable? Would that be maybe getting up early in the morning, doing at least a 10-minute exercise, stretching? Because I know half the world doesn't stretch.
Well, you figure, I always say that, candy to a tooth is like going to cause tooth decay, correct?
Correct.
The same thing for a low back. The average American spends 37 years in a seated position. So when you think about that, that's basically, if you live up to 74 years of life, 75 years, like half your life is spent seated. Well, that puts a compressive factor in the low back that's severe. And then add into the mechanism, the phone. And if you're sitting with
Yep.
or with your phone, well, that itself starts to cause damage. So we see these tendencies and these trends where people's low backs are shot, their necks are shot just from being in seated positions every day, 7 days a week. The goal is don't sit, get up, move, standing
Ooh.
desks. Yes, exercise is key. I'm a proponent of it, absolutely. But you have to still be able to you still have to not be in that seated position 24/7. I'm also a huge fan of good sneakers, having something in your foot that's going to really give you support. You can get a very inexpensive orthotic for like $45-50 that can just help that arch, which also helps the knees, and change out your sneakers every 6 months. So there's a bunch of little things that can be done, but the big thing is really the sitting is huge. And then certainly without a shadow of a doubt, getting something on your feet when you're out moving around.
Wow. I didn't know that. Every 6 months, huh?
Yeah, what happens is the sneaker, normally sneaker will last about 300 to 400 miles, as a runner. That's kind of what we know. But I also say that after 6 months, the integrity of the sneaker starts to go. Like the foam starts to give, glues start to lose their adherence. It just doesn't maintain that. So keeping new sneakers on your feet every 6 months, that's a really good, smart thing to do. Make the investment. I mean, there's merit to go to a good running store, let them do a nice evaluation. I know there's a store nationwide called Fleet Feet. They do a
Hmm.
really great 3D assessment on your foot. They do a nice gait assessment. So,
Wow.
so yeah, they do a good job. I send everybody from my four walls down here to Fleet Feet, and they're probably about 40 minutes away, but I guarantee I probably have 100 patients down there. So
Wow. Is there a certain type of brand that you recommend for the feet?
no, honestly, I mean, I've worn every type of sneaker and shoes. I mean, Mizuno and Saucony and Brooks and now
Oh,
Class. Like, so I mean, there's so many out there. So, I just think whatever the tendency is, and again, if you need a stability based shoe, which normally most people do if they are pronating, then let them look at it, let them fit you with a good stability based shoe, and then if you need an orthotic, they can give you something in there that's like $45-50, inexpensive, and then buy one or two pair, and then you can put in there and then put them in another pair of shoes that you wear predominantly.
okay. Wow.
A
So
good,
I've been
little
hearing about the hookah, I think it's called, or the
Yeah, the hookah. So you have those two. And that shoe is designed. It's been now, I'm gonna say it's about 15 years, right?
right.
So that's been around for a minute. And again, that it was a different design, which allowed kind of like its own self propulsion as you're coming down. And so I tried running on them, but the soles are so thick that it just
Yeah.
didn't work for me. I'm a hard runner. I'm a short, kind of stocky guy, so they didn't work well for me. And I'm not that fast. Let's be honest. I'm pretty damn slow. So
I'm just moving, damn it.
yeah, I'll just stay out of my way and let me finish this darn thing. So yeah, but I mean, again, it varies. Everyone has their own preference. I think all shoes have their own different unique niche as far as their support, their soul, what makes them a little bit better than other. But at the end of the day, if you're investing 150, $180 in a pair of shoes, they're going to last. The technology is really good.
Okay, wow, awesome. So, if there's one bit of advice that you could give to our audience about the spine, and maybe let's say sometimes people are walking around with a bad spine and they don't know it. Do you hear what I'm saying? Like, what would you say some of the symptoms, slight symptoms that are starting to poke at somebody so that they can at least go see a doctor or, of course, go see you? Your thoughts?
So what I'd say is that, in the body, and it's not just spine related, it's anywhere, a symptom is always the last thing to show, Mark. So, it doesn't matter if it's high blood pressure, doesn't matter if you have heart disease, it doesn't matter if you have low back pain or neck pain. The last thing that will show after breakdown over years is going to be a symptom. So again, most men and women don't know it's there. And going back to the dental analogy, you don't know you have a cavity until one day you wake up, you have a bite into an apple, and my God, I've got this horrific tooth pain,
Yeah.
right? It wasn't that apple bite that did it to it, but it's the year or 2 years beforehand that
It
this
was always there.
it's there, right? Well, it's gotten worse. Hasn't been the same. It's degraded enough. Now it's firing off in the nerve. So I'm a proactive stance in that regard. Like I said, you go to the dentist once a year to get your teeth checked to make certain you don't have cavities. Same thing happens in the back. I'm a huge proponent. You should at least get your spine x-rayed once a year. That way you can identify, see if there's anything in there that could be a problem for you, and then you can be proactive with it. If you know that you have degeneration or breakdown that's in your spine, then you can be proactive to stop it. Just because it's there. And if you go to an ortho or neuro, your primary, just because they say you have it doesn't mean it has to stay that way. You can be very
Right.
proactive to actually improve it. So, and then I'm also, again, I think everyone, I'm a chiropractor. I think everyone should be getting adjusted from birth and having those x-rays once a year. That way, at least you can monitor, maintain it, and stay in a state of health. So you don't have to worry about, substantial issues befalling you when you are 40 or 50 and faced with some maybe not so great solutions that are out there from the medical community.
What would you say? I don't want to just throw this out there for someone that sits at a desk all day.
Mhm.
Wouldn't you propose that they should at least be seeing a chiropractor at least twice a month to
So
be?
if you sit at a desk, I'd say first thing is see what you can do to make the investment. It's not that expensive to get a standing desk. So you can bring that desk up and down throughout the course of the day, right? So if you even minimize your sitting by 3 or 4 hours a day, well, that's 25 or 30% reduction, which
Sure.
is significant for your back. Also add into it, get a good pair of shoes that you can stand while you're doing that as well. Again, that also helps the lower kinetic chain, the ankle, the knee, and the hip. But then also, if you are that manner, again, I'm a firm fan, get the x-rays, get under the care of a chiropractor, allow them to keep the spine healthy and well. It's a form of preventive maintenance that's just going to be invaluable for you.
Awesome. Anyways, I just want to say thank you so much, Dr. Harris, for being here. It was a pleasure. I love your knowledge. You're on it, man. You're very zippy. It must be that drink you're drinking.
Well, no, I was up early, had a big workout, and I have to get my protein in each day, and I try to lead a healthy lifestyle, but sometimes I fall short just like anybody else. But I always say to my patients, I'm never going to tell my patient to do something that I'm not going to do. So, and I try to lead by example in that regard. And I think that's an important way to be.
Hey, I agree. And stay away from the burgers and fries at McDonald's, and everybody will be just fine.
I think that's another, maybe I'll bring that into my talks too. We'll start with that. Thank you.
Hey, you should go play with your people where you work at. I mean, at your office, and just throw some food there and see how they react, and just watch them and record it.
Yeah, I'll do that.
They'll be working and like, it's the smell, man. It's the fries that never go old, that taste so good.
It's funny when every now and then I'll have a patient that's a little delirious and I'll bring something like that in my office. And I'm like, you do not bring that in my house. That does not belong here today, guys.
Oh, you're like, I'm struggling right now. Get out in the name of Jesus.
Yeah, but it happens.
Appreciate you, man. Thank you so much for being here on the show.
Hey, thank you so very much. Have a great and a blessed day.